Every part of our body is under control of brain. If the brain is injured during its development, the person becomes physically and mentally handicapped. This damage can happen anytime during pregnancy, during delivery, or soon after delivery. Let us now discuss about one of the abnormalities of the brain, that is cerebral palsy. Cerebral palsy can be defined as damage to the cerebral hemispheres, resulting in a fixed, non-progressive lesion, further leading to grossly impaired motor function with or without other associated features. This damage may occur early during pregnancy or even after the childbirth, which we're going to learn in coming slides. Now, let us look at the prevalence standards of cerebral palsy, CP. Based on the population-based studies around the world, the cerebral palsy affects approximately 2.4 to 2.7 individuals out of 1,000 live births. It is most common among premature babies and those born with low birth weights. According to the National Survey of Children's Health, NSCH, the incidence among infants born between 24 to 33 weeks is around 12.3%. As per the National Health Interview Survey, NHIS, and National Survey of Children's Health, NSCH, the prevalence of hereditary cerebral palsy is observed in children aged 2 to 17 years. Up to 50% of CP babies are low birth weight. The birth weight of children is below 1,500 grams, according to CDC. About 1 in 323 children has been identified with CP, developed autism, and developmental disabilities. Apart from the above statistical standards, the CDC reports also suggest that the incidence of cerebral palsy is more in multiple births, that is, the prevalence among twins. It is 9 to 12 per 1,000 live births. In triplets, it is 30 to 40 per 1,000 live births. In quadruples, up to 100 per 1,000 live births. Now, let us look at the classification of cerebral palsy. It is divided into 3 major classes based on the type and extent of damage as neurological deficits and based on the types of movements involved. Let us first understand the neurological deficits involved in the disease process of cerebral palsy. Based on the extent and area of damage, the neurological deficits are further categorized as pyramidal. That is, the damage originates from the motor areas of the cerebral cortex, as in case of spastic cerebral palsy. Extrapyramidal. This class includes the origination of the deficit from the basal ganglia and the cerebellum, which is seen in athetoid and ataxic cerebral palsy. The mixed type include the damage from both the pyramidal and extrapyramidal classes. That is, it includes the spastic and athetoid cerebral palsy as well. The second category is based on the type of movement involved. It is further subdivided into spastic, ataxic, and hypotonic, dyskinetic, and mixed types. Let us discuss each of them in detail. The spastic cerebral palsy is presented as hemiplegia, diplegia, and quadriplegia. In spastic hemiplegia, there is unilateral weakness. Upper limb is affected more than the lower limb. Tiptoe walking on affected side is the unique sign. There is flexion and pronation of forearm. There is fisted hand. The most disabling form of cerebral palsy is quadriplegia, in which both the arms and both the legs are involved. Weakness is more in upper limbs than in lower limbs. Head control is poor. Diplegia is more common presentation, occurring in up to 50% of cases. Lower limbs are affected more than upper limbs. Cognition is normal. This condition is most commonly seen in premature children. In children with ataxic hypotonic CP, cerebellum and its connections are affected. Both ataxic gait and poor muscle tone are observed. There are bilateral signs. Balancing is very poor. Dyskinesia is seen when the brain lesion is in basal ganglia. There are feeding troubles in these children. The movement abnormalities include chorea and athetosis. Intelligence is normal in these children. The mixed type involves the characteristics of both the spastic and athetoid muscle tone, with associated features of involuntary movements. 25% of patients with cerebral palsy present with mixed type. Now, let us talk about the etiology of cerebral palsy. The causative factors of cerebral palsy are divided into three broad categories as 1. Antenatal causes, which accounts for 80% of all cerebral palsies, occurs as a result of group of infections as listed here. 2. Perinatal causes, that accounts for 10% and occurs as a result of asphyxia, birth injuries, and prematurity. 3. Postnatal causes, that accounts for 10% of all cases of cerebral palsy and associated with high-grade fever, head injuries, ischemia, and so on. The antenatal causes constitute 70 to 80% of cerebral palsy. They include prematurity and low birth weight, Rh incompatibility, and multiple gestations. Maternal infections, particularly with torch organisms like toxoplasma, rubella, cytomegalovirus, herpes, and syphilis, do cause cerebral palsy in newborn. If mother is a drug addict of cocaine or heroin, it may result in cerebral palsy in newborn. Perinatal and postnatal causes constitute around 10% each. The perinatal causes include birth asphyxia, complicated labor, placental abruption, and sepsis, including meningitis. Whereas the postnatal causes include head injury during delivery, meningitis, and cardiopulmonary arrest, and so on, may result in cerebral palsy in newborn.